Hello, Dr. Astwood. Welcome to another segment of Ask the Doctor. How are you?
I'm good, thank you, and happy to be here again.
Good, thanks. Now, we wanted to talk this time about the dashboard. We've been seeing a daily dashboard in 3 languages. Would you explain the dashboard to us, what it says, what it means?
Thank you. Well, the dashboard gives a snapshot or a general overview of the COVID pandemic in the Turks and Caicos as well as globally. And so every day an updated dashboard is published in the 3 different languages for the information of the public. It speaks to the number of confirmed or positive cases for COVID in the Turks and Caicos, the number of negative results that we've received, the number of persons that are suspected of having COVID, as well as the number of persons who are quarantined or isolated in a healthcare facility. So these are persons who would be in the hospital, as well as the persons who are quarantined at home. We also have indices which indicate the number of deaths and the number of recoveries. And so in that dashboard, it provides quite a lot of information, which is broken down. I think everybody would have noticed that the dashboard has been revised. I feel like the new format is much more easy to interpret. You would see arrows which would indicate if a number has gone up or if it's gone down or if it's remained the same. And so really it paints a picture of what's going on in the Turks and Caicos on a daily basis.
Great. Let's stay with the dashboard for a while. We've also noticed that the recoveries column has stayed at 0 since its inception. And people have a lot of concerns. Are we saying that there have been no recoveries in Turks and Caicos?
Well, people will be pleased to see that there will be some recoveries this week. The definition of a recovery would be persons who, at the end of their 14-day isolation or quarantine period, would test negative for COVID in 2 subsequent samples. So you have the initial test, which would have come back positive. After 14 days, you're retested, and then a day later, you're retested again. And so once you've had the 2 negative serial tests, you would be counted as recovered. And so we've known from information globally, because this is a new disease, that sometimes it takes more than 14 days for the person to clear the virus. So now you will be starting to see some recoveries, and we'll be very pleased to report those recoveries. It doesn't mean that the persons that are positive are very ill, because we have some persons who would be asymptomatic or have recovered, but they're not fully recovered in the technical sense that they would not have met the definition of having 2 sequential negative tests after their 14-day period.
Okay, great. You're giving us some great segues, because since you just talked about definition, I also wanted you to define for us what is a confirmed case, and tell us the difference between suspected cases and those people who are simply quarantined at home. Are they not suspected? So let's start with, how do you define a confirmed case?
Okay, so a confirmed case is a person who has had a laboratory positive test. And we're talking a person who's had the nasopharyngeal swab, which is the swab that's placed at the back of the nose to collect material and is tested by the PCR testing, which is the polymerase chain reaction test. Mm-hmm. That test will indicate if you have active disease, if you have the virus in your body. So persons who have tested positive are called confirmed cases. A suspected case is a person who has symptoms of the disease and hasn't yet had the result of the test to say whether they're confirmed or not. So a symptomatic person is a suspected case. The symptomatic cases can be quarantined as well as their contacts. So anyone that might live in their household or anybody who has had close contact with that person would also be quarantined. Those persons may not be symptomatic, and as such, they will not be tested unless they develop symptoms during their 14-day quarantine period. If they develop symptoms during the 14 days, they will become suspected and they will be tested.
Okay, that's good. Good to know, because this Ask the Doctor segment is all about informing and educating the public. So that was very good information. Thank you, Dr. Astwood. Now, We noticed too that the demographic information hasn't been published. What's the rationale for this decision? And the question, it begs itself. People are asking, so therefore, is COVID-19 only present in provinciales?
Well, there are a number of factors. The first is the fear of discrimination and stigmatization.
Mm-hmm.
So we don't want people to discriminate or stigmatize a particular community or island because of cases or suspected cases.
Right.
You could look at the United States and they can say, okay, we have, 1,000 cases in this town or this state, and it doesn't lead you back to the individuals. We are a much smaller country, so we have to be sensitive to our local geography and our reality. We're also concerned that people might become complacent and say, oh, well, there are no cases on my island, therefore I can just go about my business as usual. We all have to act like there is COVID around us, and we all need to take the precautions, whether there are cases in our communities, in our households, on our islands. Regardless, everyone is expected to take the same precautions about social distancing, following the stay-at-home order, to ensure that they're doing the proper hand hygiene, covering their cough, covering their sneeze, staying at home if they are ill. We don't want people to have complacency. And at the end of this, you're going to have people who have recovered and will be going back into society. And we don't want those persons to feel stigmatized or discriminated against. It. And the best way to do that is to provide factual information to persons and to try and educate people not to stigmatize either communities or individuals.
Okay. And we noticed too, we're talking about future projections. We know that that's difficult to do under any circumstance. But for instance, those of us watching the international news and you see states and countries saying that they've reached a peak, can you now say, or can you at any time will you say that Turks and Caicos has reached a peak, or are you able to project the future cases?
Well, what we have done in the Turks and Caicos, we have worked with our various stakeholders, whether it's Public Health England. Now we also have the Ministry of Defence here that are working with us. And we have done some modelling for the Turks and Caicos. But the limiting factor is that these models are based on countries with a much higher population. And so the models can't easily apply to the Turks and Caicos, but we have done modelling for the Turks and Caicos. This is not an exact science. So whereas the model might come from Europe or North America or China, which is where the outbreak originated, it doesn't fit nicely with such a small population. And then also a complicating factor is that we're based on multiple islands. Mm-hmm. So what we've done, we are trying to test more people to see where in the epidemic that we are. And so we're constantly revising and looking at our epidemic curve so that we can see what is going on in the Turks and Caicos. But we are not in isolation. We also have to look at what's going on in the wider Caribbean and also in the US and other countries which have, travel relationships with the Turks and Caicos. So it's not an exact science. There's a lot that's not known about this disease. While models do have some merit, and we've presented figures to the public on the worst case scenarios, what we are hoping is that by the government taking such aggressive early measures, which would include closing the borders, restricting local travel, legislating for social distancing, legislating for the shelter in place and non-essential movement of persons. We're hoping that we would have reduced the worst case scenario by reducing contacts between individuals and communities to try and reduce the spread. So even the scenarios that we're looking at are the worst case scenarios, but we're hoping that the interventions that have been made would reduce those worst case scenarios, and that we would have what we call flattened the epidemic curve, and that these social measures, and I think it's important to state that the general public needs to be aware that some of these measures are going to be longer lasting. So the social distancing, the restrictions on mass gatherings, etc., might be with us for many months ahead to try and ensure that we don't come to having a huge outbreak here in the Turks and Caicos.
We're certainly going to have a new way of life, aren't we, Dr. Astwood?
Yes, I mean, I think the whole world is trying to get to grips with the concept of a new normal, a new post-COVID era, where we don't expect to conduct business as usual, and particularly the usual way that we behaved before COVID. So I think the lasting effects of COVID are yet to be determined, but I think, the way of life for everybody, not just in the Turks and Caicos, but globally, will change, and we will have to adapt to this. And some of these things we have to really, accept it as part of our culture so that it becomes second nature, and we don't have to think about washing your hands more frequently. We don't have to think about covering our cough with sneeze. We don't have to think about, what to do if we develop symptoms and signs. These things need to become part of our DNA.
We know that the defense team on island is quite diverse, and you mentioned them earlier. Will they be assisting you medically in any way?
Yes, well, we have actually been working very closely with them. They do have medics amongst them, and we have been meeting virtually because we're practicing social distancing. We have been meeting virtually with them, and they have been providing technical support, and we really do appreciate all of the assistance that they have been offering us, and we will continue to use their technical expertise to supplement what we have here in the Turks and Caicos, and we really appreciate all the work that they've done so far, and we look forward to all the work that we will do together in the coming weeks.
Right. There's a lot of terminology being used there, Dr. Astwood, and for us lay people, what's the difference between a confirmed case and an active case, or is there a difference?
Well, a confirmed case is a laboratory confirmed case. So an active case is the person that still has, that still is positive case, but is still having the disease. Mm-hmm. So it's a little confusing. And so sometimes we try not to put too much information out there. Yes. When we do the reports, we tend to put a little information at the bottom so that people are aware of the terminology and so that it can be clear. But, it's a new world that we've developed, and we've all had to become slightly medical. So, we refer active cases as the persons who still have the disease, but they're not at the stage where they've been recovered. And recovered is when you have, as I said earlier, the 2 negative results. Right. Yeah. It doesn't mean that they're unwell, because you have a lot of people who have the disease but only have a mild illness. Not everybody requires hospitalization, fortunately.
Right. The dashboard also gives us information on the hotline. So how does the hotline team operate in conjunction with the dashboard, or as advised by the dashboard?
Well, the hotline numbers are very important. We have the 2 hotlines that are answered by the medical officer, and that hotline number is used for persons who are concerned or may have symptoms, who have questions, and we have a screening questions that we ask them, and if the medical officer feels like that person needs to be referred to the public health team, they are referred to the public health team for further investigation. We will visit you at home. If we need to take a swab, we'll take a swab. And if it's necessary for quarantine to be implemented, we will do that. We also have an additional number, which is for general queries. And there's also an email address where persons can direct any queries. So sometimes the queries aren't necessarily health related, but we have mechanisms to refer them onto the correct agencies.
Right. Well, Dr. Astwood, we know you're going to be joining us 3 times a week on Ask the Doctor. We thank you again for taking time out to address these questions and to give us some clarity and some more information in layman's terms that we all understand. So we want to thank you very much. We want to thank you for all that you're doing, and we're asking you to do stay safe.
Thank you, and stay safe, everyone, also. Thank you.